So a hip replacement is a procedure which has over a number of years been shown to be incredibly successful in getting patients out of pain once their hip joint has become arthritic. So mostly patients will have started to experience pain from their hip joint on a daily basis, often waking them at night. The joint may have become stiff and it will be limiting their daily activities. And often really the key point that patients get to before they're thinking about intervention is once quality of life is being affected and the physical activities that they enjoy doing. And that's the point at which most people would then start thinking about having a hip replacement. The direct anterior approach is a particular approach that can be used to access the hip joint and perform a hip replacement, which is perhaps rather less invasive than other approaches. I think one has to be clear that the most important thing about a hip replacement is that one has an appropriate implant inserted and that it's inserted correctly so that the new hip has the best chance of functioning well. However, if we can do that through a minimally invasive approach that doesn't interfere with the surrounding muscles so much, or indeed divide the surrounding muscles, then potentially that can really help with recovery. Yes, I think the key point about the direct anterior approach is that it doesn't actually divide any of the muscles around the hip. So that this means we can get patients rehabilitating a little bit quicker afterwards than we can with some other approaches. We're not so anxious about repairs that might have been performed to muscles or tendons around the hip joint, as none of these have been divided. So recovery can progress at a rather quicker rate. And I think the other advantage is that I think in general it appears to be less painful. So what we have seen from various studies done on approaches for hip replacements is that the initial pain after the surgery seems to be somewhat less, and I think this just translates in the whole recovery for the patient being somewhat easier. After the hip replacement surgery, we usually get patients out of bed either the same day or the following day, and we start active exercises of the hip straight away. And as soon as the patient's comfortable enough, we like to get them exercising in the hydrotherapy pool. Now, for the first 6 weeks, even though you may have had your surgery through a minimally invasive approach, the muscles around the hip will feel rather bruised and sore. So I think progression in activity has to take into account the muscle discomfort as a result of the bruising. But that can be helped with the physiotherapy program, but very much the recovery is geared to exercise and function. So that usually after about 3 to 4 weeks, patients may be graduating from 2 crutches onto 1 crutch, and at about 6 weeks we'd expect most patients to be walking comfortably without crutches. In terms of the longer term recovery after a hip replacement, what's interesting is that after 6 months patients will feel better after that initial 6-week recovery, but after a year they'll feel certainly better than after 6 months, and even after 2 years they will feel better than after 1 year. And we often find with hip replacements that after 2 years or so people start to forget that they've actually had a hip replacement. When someone's had a hip replacement, often a lot of the questions are around what you can and can't do, what's safe to do after a hip replacement. Because often, particularly in some younger patients, they're keen to return to sporting activities. And this will depend a bit on the type of implant you've had and perhaps the material that's been used for the replacement. But in general terms, my feeling is that we're keen for patients to return to their sporting activities. We don't specifically limit impact exercise such as running. The only thing that I think one has to be wary about is contact sports, because in that situation you're not fully under your own control and you can't be absolutely sure what's going to happen to your leg. So in general terms, contact sports probably isn't ideal, but certainly impact exercise such as running, skiing, all those things are perfectly possible after a hip replacement. And normally people can find, certainly after about 6 months, they're able to return to a degree of impact exercise as the muscles strengthen around the hip joint. Hip replacements, traditionally when we think of how long they may last, have lasted between 15 and 20 years. The issues here historically have been related to the material used for the hip replacement, which inevitably will wear out in one form or another. But I think information that we're gaining with follow-up on implants that we currently use, particularly with harder bearing surfaces such as ceramic on ceramic, tend to indicate that the wear rate of these materials is so low that there is the potential for hips to go on and last for a very long time. We've been using ceramic on ceramic for at least 15 years now, and what's fascinating is that even after 15 years there's absolutely no sign of any wear of the material used. Now what we don't know is whether that material is going to start showing problems in year 16 or 17, but all the indicators are that potentially hip replacements such as these may go on and last for a very long time, and that we won't quite have the redo difficulties that we've had in the past.